the introduction. So, good evening, everyone. Welcome to the 229th episode of Healthy Aging webinar series conducted by Vayomanasa Sanjeevani. These webinar series are brought to you under the able support of Dr. P.T. Shivkumar, Dr. Vijay Kumar Habishatar, and other professors and team members affiliated with Geriatric Psychiatry Unit of the Department of Psychiatry, NIMHANS Hospital, Bengaluru, and with the support of other participants affiliated with us. Today, the topic we are going to be talking about is an app called Constant Therapy. This app is for cognitive communication disorders. And to shed light upon this topic, we have with us our speaker, Dr. S.P. Goswami, who is the professor at the Department of Speech Pathology and Dean of Research at All India Institute of Speech and Hearing, which is located at Manasa Gangotri at Mysuru, Karnataka. Welcome, sir.
Thank you.
Also, I would request the participants to kindly DM or put in the chat box their email address, which would be used by our experts to send a feedback form for you, a feedback regarding the today's webinar. In case you don't have any email address, you can also provide your phone number, preferably a WhatsApp number, so that our research team can contact you for the feedback. So now I request our speaker, Dr. Goswami, to kindly enlighten us regarding the topic.
Good evening, everybody, and thank you. Can you hear me?
Yes, doctor. You
Yes, sir.
are completely pakka, doctor.
Yes. Good evening, everybody, and thank you very much for that introduction. I'll briefly talk to you about Constant Therapy app, which my slides are okay, right, sir? It is visible?
Yeah, it is visible, doctor.
Okay,
Yes,
perfect. Thank you. Thank you. So I'm just going to talk about this Constant Therapy app. It is basically a digital speech, language, and cognitive therapy app for persons with neurological disorders and cognitive impairment. Uh, so this CT app, basically when we looked into, so it need not only be used who have a cognitive impairment, but even it also provides a robustness to individuals who are normal. Okay, so it's something like these activities, though looks very simple, but it can be carried out persons who have issues or persons like, say for example, when we can look into certain dementias or age associated memory impairment or MCIs, even those individuals, they can carry out this. So what this app is talking about is basically this app has got like all of us have been using technology in day-to-day life, and there have been very good like last week also there was a article which they said it technology is always a facilitator for elderly individuals, okay, or the older adults. This is a facilitator. So technology has never ever been a barrier in the growth of the mankind, provided the technology what we use in what aspect we use, that is more important. Is it in terms of learning? Is it to improve our pace? Is it to improve our quality of life? Yes, certain places when there is what we call as anything which is excess is always a problem, like when we eat too much of sugar, okay, or when we take too much of stress, so we can have lifestyle issues. So basically what we are trying to say is man is the one who has made the machine, so usage of machine is always for the betterment of man. Similarly, these apps, the technology, what we have been using, it is for the betterment so that a man can carry out the activities at home. So this constant therapy app, what we looked into a digital speech and cognitive therapy app, it is a platform. Okay, it's similar to that what we have an app like you have Beam app and all those things. Similar to that, it can be downloaded. So what it does is it basically uses your AI based. So it has a very good robust system of artificial intelligence. And this app can also provide an automated assessment to an individual. Okay, let us say a person will be able to know at what level he can work and at what domain he can work, in which areas he can work. I will let you know which all the areas are there. Okay, and it is also important that this app can be used at any time, anywhere in mobile devices. Okay, any of the mobile devices. Now, recently they have also launched in Indian English versions, and it can be used in any of, whether it is an Apple based or any of the Android based. It is also reported that this app, when they have done a good number of work in terms of research, they have reported that anyone who uses this app, he uses 5 times the more therapy. Like, say for example, when we provide a therapy, like either in terms of improving their cognitive communication skills or a behavior skills, we have a fixed time, like we would have provided one session. But with this therapy app, a person uses 5 times more. That means rather than sitting in ideal, he or she will use these activities 5 times the more. And as a result, the outcome is better with lower cost. Okay. The probability or the ability of an individual to use this app is 5 times more, which is not a small. That means rather than using for 45 minutes, he is using for almost 4.5 hours. And with, when he uses or he or she uses, the outcomes are better, the cost is lower down. Plus, when we use an app, you are more safe, you are more secure. When I talked about in terms of safety and security, what I mean is it's a safety for the patient point of view, it's a safety from the clinician point of view. When we use these apps, yes, there is a misuse, but what happened when we carry out these activities, the probability of misusing, abusing is very less. Or you can carry out the activities at any time at sitting at home. So when you are sitting at home, the probability of having an accident when we go out is very, very less. So what we are trying to say is it is safe, it is secure. And this app, it has got two versions, what we call as a clinician and the patient versions. But there are almost 500,000 evidence-based therapies are used, and which are divided broadly into 91 categories. The clinician can also deliver remotely, or a patient can carry out individually, and it saves both the time and documentation and reporting, and it has a very good standardized and increased clinician utilization improves by 30%. That's one part. Plus, what happens is you can get a baseline that okay, what activities he has done, when he has done, how much time you looked into. So we can also assess the reaction time, the ability, the activities which have been done, there have been error, or the activities which have been done correctly. So it provides lot of clarity in terms of its usage, flexibility to the patient, to the person to carry out the activities, and these activities have been tested, verified, and verified. So the activities what one can look into is that there are several activities. The activities can be in terms of attention, the auditory memory, the visual memory, the analytical reasoning, quantitative reasonings, arithmetic, visual spatial processing. That means there are several activities in attention. Also, there can be activities like remembering the card. Like it's just an activity which a healthy person can also carry out. Attention in order to improve, choose which directions, find the symbols, alternating symbols. So there are several words or even alternating words, like when we looked into synonyms. So there are different levels. That is, the level can vary from 1 to 10. That means the activities are arranged in a very complex order. So it moves from a very simple to hierarchy. And also when we do it, it will automatically will say that at what level you can start. There are also activities to improve in terms of auditory memories, which is in terms of matching the words, sounds, understanding stories, following the instructions, remembering spoken words. That is what we looked into NBAC. The category specific, the alphabets. So it has got several things. Visual memories, which also had got different levels. That is, which can vary from 3 to 12. That is matching, face, picture written words, repeat pattern, remembering the right word, remembering pictures, and remember written words. There are several activities which we have been talking about is in terms of analytical reasonings. That is in
So
terms.
your slides are not moving, doctor.
Sir, slides are not moving now.
Now it is moving. Now it is moving.
I am at slide 3 only, sir.
Okay, doctor. Okay. Fine.
Okay.
Fine. So it was continuing at slide 1. Now it has gone to slide 3, doctor.
Okay, now it's okay.
It's
So
okay.
This slide is okay, sir? I'm at slide number 3.
Fine, fine.
Yes,
Fine.
okay. So you can have activities which are with reference to the visual memory, okay, with reference to the analytical reasonings, like reasoning which can work from alphabet to roadmaps. Quantitative reasonings we have been talking about, which can be from a functional point of view, solving problems, clock, money, and everyday math. Arithmetic, even there are levels which are started from 5 levels in terms of addition, subtractions, multiplication, and divisions. Visual spatial processings like symbols, alternating symbols, or shapes which are same or different, clock, time, calendar, repeat pattern, and alternating words. Sir, I had gone to the next slide. Then there are,
It has to move, sir. It has to move, doctor.
okay.
The slide is not
Yes.
at move.
Okay,
It
sir.
has to move.
There are also specific activities which are in order to improve your speech language skills, like auditory comprehensions, okay, which has got activities from 1 to 10. Word retrieval we have been talking about. I think someone's mic is on.
All mics are on mute, sir.
I request everyone to keep themselves
Yeah. All mics are on mute only.
Yeah, please. Okay, no problem. Thank you. Okay. So basically, there are also activities to improve your speech language therapy exercises, like in terms of auditory comprehensions, where the activities range from 1 to 10. There can be activities which are there for word retrieval, that is from 1 to 6 levels. Okay, so word retrieval, we have been talking about identify picture features, identify picture categories, picture sounds, rhymes, counting, naming. We looked into naming. So naming can be at the pictures. We call it as a confrontation naming, lexical generative naming, word fluency task, okay, description of the pictures. So what happens? All these activities directly or indirectly also taps your cognitive skills. There can be activities which, in terms of the repetitions, which we move from level 2 to level 5. That means these activities like imitate the words, repeat words, numbers, active sentences, okay, passive sentences. So what they have been talking about is that it will also talk about your memory in terms of your working memories. Oral reading, in case the person is literate, we can use the activities from the right reading the words to the numbers to listing to complexes. There can be also sentence productions which can, with reference to the form, describe, and passive or the active sentences. Talking about everyday things, what we looked into in terms of the time, the concept of money, reading comprehension, which we have been saying, these are the levels starting from 1 to level 3. Okay, so these can be understanding written words, read, paragraph. Spellings can be there, like copying a word, spell out here, spell out what you see, spell out what you here, spell out what the words have been copied. Phonological processing, which we are saying, like hearing different words, like whatever the phonemes we say, pick letters to the match sounds, because this will talk about how good is the phonetic process. Sounds which match letters, count the number of syllables, identify sound words, and identify. So all
बहुत clear है.
these activities will improve in terms of speech language. Like say for example, I can just say it like this is a simple exercise, though the English will be little. Say for example, when I so here it will talk about loudness also. When I 10 o'clock. Okay, so it says correct. So what happens? There are individuals whose clarity goes. So you can carry out these activities. So it also gives you instructions. You can carry out the instructions. You can skip. Okay, same things. Say for example, when we talk about symbols, okay, so here what this is.
Tap on all the symbols that match the large symbol on the left.
Okay, so when we tap it, right? So
you found all the symbols.
Same slide is there. It is not moving, or then when you tap something, it is not coming out anything. It is as
nothing is coming out, sir.
No, sir.
Coming, sir,
The same
Kindly listen.
Slide, when you say that the tapping this, that, nothing is happening. The same slide is appearing.
Yeah, it's just talking about it has not moved. I have not moved out.
Sir, doctor is not moving the slides. He is
I
just
have not moved it. Now I had moved the third slide.
see. Doctor is just testing that app. That
Yeah,
app.
I'm just testing it.
App is speaking.
Yes,
That
app is speaking, not me. It's not
yeah,
me.
yeah. It is the app that is speaking.
Yes,
So you have to listen very carefully.
yes. It's not me who is speaking.
Listen to the instructions. Place the violin below the fan.
Below.
Then place the orange to the left.
Okay, so it says place the violin below. Yeah, so it talks about the wind. And then yes. Then orange. So what it is talking about, it gives a clear-cut instructions to the person.
Listen to the instruction.
Okay, like we all have been playing this game. So I'm just trying to say what type of activities these are.
Memorize the first card that you see. When you're ready, tap Start. Tap each card that matches that first card in the deck.
So whichever so when we just say tap, it provides you the clarity of this.
Memorize the first.
Okay, so these are the just I gave you an example, but there are n number of activities which are present in these activities because there are 500 and 1000 activities, and which now at present these are available in English, but this is also available in Indian English, which will be lost. But what this does is, because there are two versions, one can be the patient or the clinician version. So patient versions, like anyone can use it, and they provide it around 14 to 15 days. It is free of cost. But what happens is when we use the advanced versions, so what you
Doctor, you are muted, doctor. Doctor, you are muted.
okay now sorry.
Yeah. You are muted. Yeah.
So what it does is basically it provides you several activities in two versions are there. One we call as the clinician version and another what we call as the patient versions. So what it does is basically they are called as the enterprise version and all. The enterprise version is an unlimited where they have been charging certain fees. But constant therapy app, which is free version, which you can use it for 15 days again, you can use it. But when we use this paid version, what happens is it provides your efficacy, and it also provide you a world class assessments, treatments, unlimited, automated, and it also sends to the family member that what activity he has done and how he or she is progressing. And one can monitor remotely, like for example someone is staying in Bangalore, someone is staying in Mumbai, or someone is staying, okay. And it has got a very high level of security. It has got a HIPAA compliance. That means your data is well protected in this. It cannot be misused by this. Okay, so one, and it has got a several dashboards which one can use remotely, centralize the patients, and it can have an automate and which activity the patient has done and how he or she, even you can just look into that, okay, what number of activities has been done, when these activities were done, okay, what was the average number of activities one has done per day, how much, and which all domains they have done it. Basically, okay, it has been proved this app that this app has got a very strong evidence. Okay, there are apps which we can use it freely available and all, but they do not have a strong empirical clinical evidence. Okay, and it has been widely used in USA. Now they are also trying to use it in India. So it has been reported that there are almost 700,000 million users, and median age is 65 years of individuals. There are more than 270 millions, and there are more than 17 peer research. That means it is basically a part of a research groups, and 70 plus studies have provided your clinical evidence, and there are several clinicians as well as patients who have been using. These are certain things which we can say. I will just give you one demo like how.
I am a teacher, and I had the for like 3 months. I didn't talk at all. Constant therapy is miraculous for me. And when I go to doctor's appointments, I take out my therapy and do tasks until my name is called, and then on the ride home, I will be doing constant therapy.
Yeah, perfect.
And every year I have made progress. Even the superintendent of Lynn Public Schools just saw me Tuesday, and she said, Mary, you talk almost perfect. And I said, oh, thank you.
So she has been able to carry out, and these are certain live examples. So what they have been, why they are trying to say is because she has been a person with a stroke as well as a TBIs and all. There have been, and in case if you wanted to look into, there have been a very comprehensive, and it is available on the website also. Okay, so basically it can be used for different populations as well. Different, like we can look into persons who is having a stroke, persons who are having a TBIs. Okay, or degenerative disorders like your mild cognitive impairment individuals who has got dementias or a primary Parkinsonisms, multiple sclerosis, and even into young kids from the age of 10 years onwards, one can use it because these activities can be monitored. Like rather than using certain, watching certain other reels and all, these activities definitely make them meaningful in their persona. So this also has what we, this is the research what they have done. This is not what I have been talking about, and they have said it that a person who is using a current standard care as well as a constant therapy app, they have said they use 5 times the more therapy, and as a result, the outcomes have been better in this because these are the people who can use it at home. And there have been a good number of studies which have been done on the patients. Okay, so what they have done is they have assessed the stroke patients. Okay, so these stroke patients, they were underwent for 2 groups. Okay, they have done, one is the one who was 10 weeks of self-managed therapy, workbooks and all, they have carried out the activities, and another was the experimental group where they carried out using the constant therapy app. So what when they did, and they have done several tests and all, what did they found was that when a person uses a constant therapy app and when he uses a self-managed therapy, there's a lot of difference. That means person who has been using constant therapy app, the improvement what they see is much more than the control group. So what they are trying to say is that there is a significant engagement among constant therapy patients or the persons. Okay, and there has been a statistically significant clinical meaningful, they have been talking about clinical meaningful improvement. So when we use, there has been a very obvious clinical meaningful in terms of their overall communication as well as cognitive communication within 10 to 10 weeks. And they have done several standardized tests which we don't have to look. And then what they did is they also tried to look into the dementia patients also. So there they have used the dementia patients and control. So the same philosophy they follow, that one group who went for a constant therapy, another went for a without constant therapy, which they followed the routine. And what they found was that the rate of adherence in individual is much more when they use constant therapy app. And they also found out that individuals have shown a significant improvement whenever they have any dementias or any age associated memory impairment. So it definitely helps them to carry out these activities. And what they have done is they also try to look into, these are the bigger studies when they try to do it, and it's basically, it has come from the Boston group. And what they have said is that they wanted to try to find out the doses of the therapies. So what is an ideal dosage of therapy for persons who avail these therapies? So what they have reported is that usually the ideal dosage is 4 days or 5 days. Maximum your improvement is seen when a person attends 5 days per week. Okay, that is the ideal dosage when a person wanted to change, significant difference when it comes in terms of their cognitive. So they have looked into this. There have been certain industries also, and then we also try to test this app in order to like how our patients have been performing. We try to use it to both the Kannada as well as the Hindi speaker individuals. And what we did was we had done it around in 13 patients. So we looked into the compliance of the task, the literacy level of the individuals, the accompanied caregiver, the research caregivers, knows to use smartphone, intervention taken earlier. So what we try to look into is that the people who have been using this app, they have seen that there are the number of tasks which are being completed varies from 9 to 20. Literacy level, we had seen both the literate people as well as the illiterate people. There were people who were accompanied by their caregiver, but there were people who were not having accompanied. When it was guided by a clinician, what happens? There were good number of people who were guided, and there were few who did on their own. Then we also try to look into that what is the usage of the smartphone, whether the person knows the usage of the smartphone or not, and whether he has taken earlier intervention or not. So this was a very beautiful outcome when we try to look into about this app, that when we use this, when it was a clinician guided, okay, when it was the therapy was when it was guided clinician, okay, that is when a clinician does it, the compliance rate is very good, okay. And when self remote, when a person uses, the compliance rate is low, but definitely there is a compliance, but the rate with which they have been using, the activities what they have been using, the amount of treatment what we see, that is little low. When we looked into your adults, young adults, adults and older individuals, we found it's a very interesting things that the compliance rate was good in young adults as well as in older adults, but poor was in adults, specifically between 30 to 45 of age. The compliance rate was very low, and when we analyze these things, we felt that this is same as the Maslow's model. So people who are very young, they all thought that they have a ladder to grow. Hence, their motivation level, their commitment was very high in terms of young adults, specifically who are in 20, 25 and all those things. They always felt that they can do very well. But when we looked into the older adults individuals, okay, their compliance was also good. Like when we looked into geriatric population and all, they were also doing, because these are the people who always felt that they can do better because they have more wisdom, experience and expertise, plus they already have reached to the self actualizations. But these adults, when you looked into middle-aged individuals, they had got a poor compliance. So our assumption was that when we looked into these adult people, we find that these individuals have neither they are too young nor they are too old. So it is like a sandwich. In the sandwich, the issues are much more than the old and adult. That means the usage is much more and they show a good improvement. When we looked into task compliance intervention, someone has taken it, we always found that someone who takes an intervention, his compliance was good than person who has not availed an intervention. That means usage and outcomes are better. And when you looked into in terms of literate and illiterate, usually literates have good better compliance because of the awareness, accessibility and affordability compared to poor literate, but poor literate does carry out the activities. When we looked into the caregiver support, we found that individual who has got a good caregiver support, they had very good compliance. That means outcome was better, and poor compliance who were not having a family support system. Similarly, when we looked into the usage of the smartphone, so we found that smartphone uses has got, whether they have a prior knowledge or not, or they were using or not using, there was no much difference. So there was a fairly good compliance. If the person knows or he doesn't know, it does not have any impact. So what we reported was that caregiver and guided therapy are the best outcomes, okay, that is, but literacy, knowledge of the usage of the private or previous usage of the smartphones are not the prerequisite to use the technology in older individuals or across the age. When we looked into that, means anyone can use a technology, and if used in meaningful way, it brings lot of change. And this is the app which is available at this. But if you have any other queries, suggestions, you can please ask me. I am available now. About this app, in case if you have sir any queries, suggestions.
Doctor,
sir.
Your internet is hanging.
Sir?
You have gone. Your internet was hanging for some time. Now
Okay.
you have come back.
Oh, till where it got hanged, sir?
So, I mean, you were explaining about the usage. About
Okay.
the critical aspect was not the usage by the person knows the usage of the smartphone.
Okay. So I will repeat it. Don't worry about that, sir.
Thank you,
Not a
doctor.
problem. Not a
Thank you.
problem.
Thank you.
So I was just talking about that usage. Okay. I think I was intervention I talked about, right? So I was talking about literate and illiterate.
Yeah, that you have spoken, doctor.
Okay. So I was talking about in terms of caregivers.
Also, that is also okay. But
Okay, so I was talking about usage of the smartphone. Okay. So we were just saying usage of the prior knowledge of usage of the smartphone is not at all a variable. Whether the person knows or does not know, he or she can carry out the activities effectively. Okay, the usage is not a criteria. And here, that's what I said. The important thing is the caregiver support and guided therapies are the one which makes a lot of difference rather than the literacy level of the individuals, the knowledge of usage of the smartphone, age of the individuals are not at all variable and anyone can use effectively. That means technology, the myth that older individuals cannot use effectively, that is still a myth. Fact is that they are equally competent, what the so-called generation next or Zen next or whatever, whoever have been talking, all are equally able to use it. Pace may be different, strategies may be different, but effectiveness is quite common in this. Any queries, anything which you want to know, sir?
doctor, I have already downloaded this. I mean, as you were listening to
Yes.
us, see, but I think after 14 days trial, the amount.
Yeah, 14 days you can use it, sir.
Yeah, after that, the amount quoted is in dollars and it's
Sir,
quite
it is, it will comes around 3,000 rupees
per month.
per month.
Yeah.
But in case if you wanted to use, you let me know, sir. I can just ask them that if we give it for little longer duration, can we cut down that? I can talk to those people also.
Okay, doctor. That will be.
Anyone is there, sir, you can let me know.
Yeah.
As a group, I will try to tell them to cut down it.
Yeah, that will be a good. In fact, I have mentioned your name also because who has recommended this to you? I have mentioned your name, doctor.
Yeah, please, you can even leave a text to me. I will leave my number, sir, here.
Yeah.
It's not a problem because it's basically to make people to use it. Okay, it's basically when you cannot move around and can use it for a better health.
Thank you, doctor. Thank you, doctor.
Any queries, any suggestions if you have, sir?
I mean, people can unmute themselves and talk to the doctor.
Sir, anything, sir, any case, in case if you have any issues with reference to, like we have been also talking about, because this will also give you an idea about your hearing acuity also, because in case person is not able to discriminate it, then we says, okay, there might have been issues with the hearing also. So it works both at a preventive level, secondary as well as the tertiary levels.
One can easily unmute.
Yes, sir. Sir, personal interactive therapy. Yes, sir. All when we looked into online, this is also an online, sir. What our research have shown, sir, whether you use online or offline, usually there are no differences. But yes, there can be issues. Individual differences can be there. Sometimes people are more comfortable in face-to-face with the person than using an online. But outcome, our research have said that telemode is as effective as we do it in your face-to-face.
Doctor, my only question is that does it need any previous history of sickness or something like that, doctor, or can it be used by anybody?
Sir, it can be used by anybody, sir.
Therefore, to avoid getting into this kinds of situation,
Yes.
probably this will be useful to so that we don't get slip into this kind of cognitive disabilities or mild cognitive engagement. All those
Yes.
things, we don't get into that.
Yes, sir. No, it's not that. It's not always that, sir.
Okay. Therefore, anybody can use it. It's open.
Anybody can use it, sir.
That's right, sir.
It stimulates, basically, it stimulates, sir. It is basically meaningful activation rather than watching reels and Facebook of someone else. We can use meaningful activation.
Equal activation. But what is the normal time for which it can be used?
Sir, usually they say individual who have been using, they can use between 45 minutes to 4 hours. That's not a problem.
That's
And
not
it is up to you how pace you use it, at what level you use it.
Okay.
There's no, it has not shown any adverse effect till now, sir. In
Because-
all, it has not shown.
Because normally, clinging on to your screen for a long time.
Yeah, screen time, sir. Yeah, we said that screen time, longer screen time should be avoided. But 1 hour, 45 minutes, 2 hours is not a bad idea.
Not a bad. Thank you. Thank you.
It stimulates basically.
And lots of activities are there inside.
There are lots of around 500,000 activities are there.
Lots
And it has got at level 10s.
1 to 10, I see.
Yes, sir.
Is there also any plan to expand it into Indian languages, sir?
Yes, sir. They have been talking about this. They are going to come out, I think, in couple of days, they might launch it in Indian languages, in India, English. Then they wanted to put it into Indian languages, and across the globe they are trying to do this, because this is what their future plan is there.
Okay.
Because they have to go, the testing is little more. They are not those big companies.
And how easy the user interface means, the design and overall the accessibility?
It's very friendly, sir. There are no issues with this because there are self instructions in this, sir.
And in terms of the performance of the device, does it require any very much good RAM device?
No, sir. Because all Android phones you can use it.
Sir, how to download it?
Sir, you can just go to your Apple store or you can go to your store, sir. You can just put Constant Therapy CT app.
CTI, yeah.
Okay, thank you, sir. Thank you.
It is easily available. In fact, as I was.
Yes, sir. Anyone has got any issues, you can just tell me. I can also instruct someone to get in touch with you guys. I can tell you, sir. Not a problem. Please leave a message to me.
See, doctor has already given his number.
My mobile number is there, sir. You can leave a text to me, sir. And you can just say you have come from this group. Definitely, I'll help you.
So we can install this app in both ways. The link is also appearing on the screen, and also we can just search in the Play Store, like I just did, and it just pops with the icon at the top on.
Yes, sir.
You'll be sharing the phone number, sir? I mean,
I have written it, ma'am. It's 9480. I wrote it, madam. 9480.
Second, doctor. 1 second, doctor. 1 second.
16.
94860.
Sir, 9480.
9480.
16.
16.
92.
92.
16.
16.
You can leave a text to me, sir, on WhatsApp, sir. I will get back to you, sir. Or miss, I will. We can help you out, sir. Not a problem.
Dr. Goswami.
I want to ask the participants, does any of the participants has used any of the similar apps available on the market? Any app available in the Play Store which resembles such apps of cognitive stimulation?
Have you used, have you tried it?
No, not. This would be the first time.
Yeah, in fact, doctor, this is the first time that, where we are very comfortable, where we get a comfortable information that it can be easily used.
Yes, sir.
Most of the occasions, we get a feeling that you are not supposed to use these kinds of things or something like that.
That's a myth, sir.
Yes.
Doctor, I got one question, doctor.
Yes, sir.
Are you aware of the sort of tests conducted by CBR, that is Center for Brain Research, by the Indian Institute of Science here in Bangalore? They conduct this sort of similar tests on senior elderly people to recognize their cognitive reactions, etc., etc. Is it similar to that?
Yes, sir. Here also, sir, you get reaction times.
Mm-hmm.
You get a reaction time here.
Yeah, but they specify a certain time and within which you got to recognize something and all that. Is it similar to that?
Similar to that, sir.
Okay.
Sir, but in this test also, they have used both the fMRI studies also, they have used it, sir.
Mm-hmm.
That Boston group has used it very extensively.
Okay. And when you say this 3,000 rupees per month, is it to be continued every month, or how is it going?
Sir, it is 1 month, sir. Monthly basis. Monthly.
It's a limited period, 1 month.
Yes, yes.
Okay.
But sir, in case if your group is there, sir, you let me know. I will just ask them for some discount and all. We can do it something. Please let me know.
Yes, sir. Please, sir.
I
Because
will definitely try to do
monthly
it.
cost is very high, sir.
I'll try to do it, sir.
Yes, sir. Please, sir.
No, sir, you don't have to tell me, sir. I will try to talk to them that, okay, this is an exclusive group, elderly individuals. We can talk to them, sir.
And in fact, we can also contribute a lot to their research, doctor.
Yes,
Because
sir.
these kinds of groups start using it, we'll be generating a lot of data.
Yes, sir.
That will be very useful to them, doctor.
Yes. And sir, data safety is 100%. No one can misuse the data.
Yeah, that is very, very important.
That is 200%, because there are certain apps where they share the data. It has got a HIPAA compliance.
HIPAA compliance.
So data cannot be misused, sir. Your personal identity cannot be misused. That much. That's the one thing which we have been asking. Sir, corporate, sir, I don't know about the corporate and all, but I can talk to them, sir. In case if we have been looking into, we can talk to them, sir. If you are looking into one rate, we can just ask them, okay, 10 people or 20 people are using, we can ask them to use. Or what we can do is, I have been talking to them that we can pay, means they have been, I'll talk to them about some pricing. I'll talk to them, sir, and I'll get back to you. You can leave a text to me, sir, no problem.
Thank you, doctor. Thank you. That helps. That really helps. Instead of doing so many crossword puzzles, this, that, etc., etc.
Yes, sir, those words are also there, sir. There are words which are complex words.
Complex words. This is one app which contains everything.
Everything, sir. It contains everything, sir.
From starting from speech to everything. Yes.
I think they are also going to add one more feature is, I have been talking to them that in QRS you can add, it's your time to use medication. Reminders.
That will be really useful.
Yes, that one thing we have been asking them, that if you can ask that, older individuals will have little more better.
There will be a pill reminder also, something like that.
Yes, sir. Yes, sir. Sure, sir.
So I have a question.
Yes, ma'am.
We have to tell the patient to download this app.
Ma'am, you can also use it in your phone, madam.
Okay.
It need not to be anyone else. You can use it. You can ask, like, say, for example, if you have used, sir can also used, you can also used.
Okay.
One app may multiple people can use, madam. Or as your wish, you can also use it. One. But you have to download in one phone, madam.
And you can be a chief of this family, and the entire family.
Yeah, family also can use it.
But I saw those features.
Yes, sir.
One common email ID you can give.
Yeah, we can give one common ID and we can share it.
And it can be shared with the family members.
Yes.
Doctor.
Sir.
Please.
Hello.
Yes, sir.
Mr. Manjunath, sir.
Sir, Manjunath, sir, you are mute, sir.
Please unmute yourself, sir.
Yeah, can you listen?
Please,
yes,
please.
Yeah, there are, you said that anybody can use. Supposing there are two persons, A and B. A uses, B does not use. How do you differentiate, say, after usage of, say, 1.5 months, 2 months? What is the difference you find between A and B?
Sir, we can give two different mail IDs.
Yeah. No, you didn't get my point. What would be the difference in their performance or outcome?
Sir, in case people uses, the outcome is always better.
In what sense, doctor?
Sir, in terms of their reaction time, in terms of their speed, and in terms of the task.
Okay. You mean overall they would be smarter?
Sir, actually, let me put it like this, sir. I think senior citizens are always smart, sir. We should not question that, because your wisdom, experience, expertise, patience cannot be measured.
No, when you use it, he will be more smarter, you mean?
Sir.
Okay,
more
thank you.
Smarter and handsome, sir.
Okay.
Tangarai, sir. caregivers, caretakers can use.
Yes, sir. Caregivers, anyone can use it, sir. It does not have any barriers.
Any other questions, sir? Please. Any other doubts? I think doctor has, so far.
Will it help? Will it help a diagnosed patient of dementia, mild to moderate?
Yes, sir. It can be used with the dementia patient, sir. Mild, moderate, it can be used, sir. Not an issue. It
Okay,
brings
sir.
a lot
Thank
of
you,
change.
sir. Thank you.
In fact, it is. I think it's a very good instrument for a dementia patient.
Yes, sir. Dementia, sir. Dementia stroke patient, it is very good.
Very good instrument, so
Yes.
that they can be engaged, and I think
Meaningful engagement, sir.
meaningful engagement can take place. Yes.
Yes, sir.
But probably they need to be monitored by their physician or the technician.
No, sir. No need to monitor, because your scores automatically can be monitored. You will know it, how many activities you have done it. No need to monitor it. You will get your baseline.
Yes, that's good. That's good.
And even someone has got a right side paralysis or paresis, he can use with the left hand also.
Oh,
that features are there.
Sir, I have a question.
Yes,
How
ma'am.
will, suppose, for example, a dementia person has to remember things that what he has.
Yes, ma'am.
Yeah. So how will the patient who's having dementia can see what he is doing and how he's been rated?
Ma'am, for dementia patient, madam, assisted we talked about, madam, caregiver, support staff, whoever is there, they can help them to carry.
Okay.
Yes, ma'am.
Okay.
Yes.
Thank you.
Yes, yes, ma'am.
Sir, I have a doubt that as you said that people of all age can use this. So for the younger populations or the healthy populations, is there any discriminating, is there any differentiating levels that the healthy individuals can go for a higher level of these tests or these problems?
Sir, what happens? It has got level which can vary from 2 to 10, sir.
Okay.
So at what level first time you have done it, that becomes your baseline.
Okay.
So you keep on increasing that levels.
Okay.
Say, for example, you can also use it in children with learning disabilities, children with autism who are verbal, children with ADHDs who are verbally, they can also use it, sir. Children who have got specific language impairment, they can also use it, sir. So it because it's an AI generated, so it knows your baseline, then it increases.
So do we have any other doubts or queries regarding this app from the participants?
No, doctor, in the Play Store, there are two things appearing. One is constant therapy brain rehab. The other one is constant therapy clinician.
Clinician. So brain rehab you can use. So there will be one pink and black. So use black.
Yeah.
Black.
Which one?
Black.
Okay. That is brain rehab. Okay.
So one person has asked that can it be used for disorders like schizophrenia?
Sir, schizophrenias and thoughts and all, in case if they wanted to use, they can try it, sir. There's nothing wrong in that. Because it will be meaningful activities.
I guess the only class of persons who would not be able to use it would be those in a moderate form of dementia.
Moderate to severe level, they can use it, but they require assisted uses. Independent uses will not be there.
I think this is a very versatile app which can be used in assisted as well as direct.
Yes, sir.
That way it's a very versatile app.
Yes, sir.
That's a very great, doctor.
Yes, sir.
We are waiting for the Indian languages, sir, because in our care homes, it will be of very great help for
Yes, sir.
dementia patients. Yes.
because in order to understand the instructions, the main important part is the instructions, that how we have to perform this activity. So if it is in the native language, then the person would be able to better understand how, and the performance would be more better in this case. So if we are done with the queries from the participants, can we go ahead for summing up itself?
Go ahead, please. Permission of this.
I request Dr. Goswami to give us an ending remarks regarding this.
Yeah.
So thank you very much, and I really appreciate for your time and the zeal with which you had asked certain queries. Anytime any queries are there, please let me know. Thank you very much. I wanted to thank each one of you plus NIMHANS team. Thank you very much, and have a good day, sir.
Thank you,
I
sir.
request
Thank
all
you.
the participants, if you have not entered your email address or phone numbers for the feedback form, kindly either put it in the chat box or DM personally to the Vayomanasa Sanjeevani account, so that our research team can contact you for the feedback regarding the session. Either your email address or your phone number, you can just put in the chat box.
So many people have already put it in the chat box. Kindly collect them. But in respect of people who have not already put it, I think we are going to again remind them. I will request once again all the people to put their phone number at least. See, I have lots of phone numbers with me, but still I think some phone numbers or some new members are also there. So which I don't have. So my request is that please put up.
In case you're not having any email, you can just put your phone number, preferably WhatsApp.
Yeah, that will be useful, so that they can send you the feedback form. So in fact, one thing I tell you that is that NIMHANS is trying to evaluate what is the effect of these kinds of webinars and how useful they are and how they really resulted in change of our habits, especially to the senior citizens. This is one study that NIMHANS has started. So for that, they have got a set of forms, and this set of forms have been discussed at various levels, and they have been finalized. And that is also there in our group. I have put it up in the group. Therefore, kindly see that form also. If you have got any suggestion on that, please send a feedback to us. Ultimate idea is that there should be a take-home message from all these things, and that take-home message should be useful to the seniors. Ultimately, that is what, and what we do is that it is useful to us, not only to us, but also to our friends and neighbors and people whom we can influence, to whom we can talk. Therefore, ultimately, we want a healthy age, healthy people to be built up, so that at all ages, irrespective of the number of the age, all are healthy. That is the objective of these webinars. So how far they are achieved, and what is that we can do to achieve that if it is not achieved. And improvement is always possible.
Absolutely.
Suggestions you can always come back to us with your suggestions. Thank you.
Thank you, sir.
So we'll meet up in the next webinar next Monday. So thank you all for joining in. Thank you, Dr. Goswami, for enlightening us regarding this topic, and Jambunathan sir for supporting us during the session. So I wish you ahead a lovely evening. Thank you.
Thank you. Thank you. Have a good day.
You have all of you have a good time, good evening, and thank you. All the best.
Thank you, sir.
All the best. I think let's stop recording.
Yes.